Hi, and welcome to exam two. So lots of things to study. This is probably one of the biggest sections, so really throw your time into this. So after reviewing the test, the biggest section of this test is electrolytes. I would say maybe even up to half of your test is electrolytes. Not that you should solely focus on that, but really look at those, okay? Things to really know: lab values. Um, a few of you have reached out to me asking what is the best way to study. It's hard because everybody studies differently, but if you are a visual person, aka you don't want to take everything out of the book and just memorize it and read through it, which is a lot of reading, make a spreadsheet. Okay. You could have columns and you could put lab values, causes, manifestations, aka your symptoms, treatments, things like that. And then on the side, say hypokalemia. This is my normal value. This is, and kind of run through it like this. Another column to think about adding is medications as well. Um, I like that because I'm a very visual person, and you can just look at your chart when you're trying to study all this information instead of trying to delve through the book. Plus, a lot of people do really well with taking pieces out, and once you start writing them, it really starts to stick with your memory. Um, you read, great. Then you review the PowerPoints. Now you've seen the information twice. You have to see this information at least 5 to 8 times to really stick in your brain, okay? So don't just look through things once. You really got to throw yourself through there. So know your lab values. Know if those lab values are off. What are your interventions, such as medications? Just a reminder that if just because it's an extreme intervention doesn't mean it's the first intervention. AKA if somebody's potassium is like, meh, just a little high or low, you're not just going to say, I'm going to throw IV potassium at them. No, you're going to say, I'm going to educate them to increase their potassium intake, blah, blah, blah. Things like that. And then know how electrolytes relate to each other. Big one is calcium and phosphate. I'll say it again. Calcium and phosphate. Know how they relate together. Okay. Know your electrolytes. That's really going to help. Things like a lot of this is mixed in with fluid, right? Patient has low sodium. What would their symptoms be? What meds or fluids would you give them? Things like that. So the biggest section, definitely those electrolytes. Next, I would say is probably the elderly, right? Remember that things are hidden, right? They don't have these massive high fevers. They don't have huge signs of infection. Always think confusion. UTI in my head, confusion with elderly people because they won't show all these amazingly crazy symptoms that you'll see in other things. You'll see confusion, and that's when you should really think infection. Know how you're going to interact with elderly adult versus other people, right? Then let's talk fluids. When you are looking at fluids, know which fluids are hypotonic, hypertonic, and isotonic. Those are important. And then what manifestations of fluid volume deficit. Knows those things. And then I would say the last thing is probably knowing your metabolic acidosis, right? In your PowerPoint for that week, slides 15 through 20 are really good at showing a visual of those manifestations. Again, I'm a big fan of charts. This would be another great chart to have. What is it? What are your what causes it? What are your symptoms? What's your treatments? Big things to know. Yes, manifestations, causes, treatment. Compensated versus uncompensated. Also pretty big to know. Okay. Please take time, study, use the tutor. She is awesome. She can help you with this. I was telling somebody the other day, I know my first year, I was a straight low C student because I couldn't figure out what was best way to study for me. This is the time to try all different kinds of studying techniques and figure out what works well for you. SurePath, an amazing utilization as well. So try all these things. Again, a spreadsheet might be really useful for you. If you know for sure that's not your way to study, don't do it. Find what's best for you. Put a lot of work into this test, okay? This is going to be the really make or break test. This is a lot of hard content, but focus on electrolytes, but don't forget all your other sections. And know your wound healing, okay? Just kind of your patho behind it. That's also a big one. Okay. You got this. You can do it. Best of luck. Let me know if you have any questions. Okay. I'm happy to help you. Thank you. Bye.